Welcome everyone, Dylan Gemelli here today with a brand new video for you. So today we are doing a highly requested video about post-cycle therapy. Now just remember, I am not a doctor. I'm only giving you information that I believe, that I've put together, that I've studied. Nothing further than that, not telling you to do anything. All I'm doing is explaining to you things that I have learned over the years or observed. So what you do with it from there is strictly up to you, but this is for entertainment and informational purposes only. So let's talk about post-cycle therapy. Now, I've been talking about this for a long time. Anybody that's followed me on the forum, I've done videos in the past, but it seems like a lot of guys still have questions about the way to run the right kind of post-cycle therapy, which is fine. Now, people will call it a perfect post-cycle or a complete post-cycle. It's not just an idea or a concept or a medical study, all right? It's something you have to develop with a lot of trial and error, a lot of years of doing this. Now, I have discussed this for, I don't know, probably close to a decade now and gotten into it. And there's always conflicting information. People that say this, they disagree with this. But let me just put it to you this way. Over the years, and I'm sure many of you have seen this, you just see so many people saying, oh, post-cycle therapy is like hell on earth. It's the worst thing ever. I don't even want to do post-cycle. There's no point in doing post-cycle. This is why we should just cruise. Everybody's going to lose their gains. I mean, you will hear, it will sound to you like the worst horror movie you've ever seen, like watching Freddy Krueger when you're 3 years old, okay? That's what it seems like, though, and it's so overblown, and it's so what's misunderstood, misinterpreted, the wrong concepts and ideas are given. And, you know, it's okay because it's fair, because people have struggled and people have, but they've done a lot of it wrong. So I guess what I want to do is try to explain to you how to fix this or how to overcome these problems that certain people have. You know, back in the day, a lot of guys didn't even run post-cycle therapy. They just kept cycling nonstop. And they had a lot of serious health problems and side effects. Liver damage, heart problems, testicular atrophy. And, you know, guys would go, well, they did it back then. They did it back then. Well, let me just tell you something. These guys that did it back then, do you think that they got up on, well, they didn't have YouTube back then. So I'm saying, do you think they got interviewed, gave press conferences, gave interviews, etc., and said, oh, yeah, guess what? I used steroids and this happened, this happened, this happened, this happened. I don't think that is happening. Call me crazy, but I'm highly doubting that. And a lot of guys aren't going to get older and admit it either. Okay? But there's been a lot of issues over the years. A lot. So, you know, it's constantly being on cycle is very, very risky and dangerous. It's going to shave years off your life. All right? Just understand this. The way things were done back then, they just didn't have as much knowledge. They didn't have as much know-how. They didn't have as much products. They didn't have as much ideas. So they did the best they possibly could. Doesn't make it right. That's why things evolve over time. We're not still listening to tape, cassettes, and CDs anymore, are we? No. We're not watching big tube TVs or taking those phones, those rotary phones, da-da-da-da-da, da-da-da-da. We're not doing that anymore. Okay, so things do change, everybody. Things get better. All right, so that's what I'm getting at. We're not using pagers anymore, right? We have cell phones. So, what makes a complete post-cycle therapy? One, number one and foremost, you got to jumpstart your HPTA, natural testosterone production. Number two, you got to prevent catabolism. Number three, you got to prevent fat gains. Number four, you got to prevent strength loss. Number five, you got to balance your hormonal levels. And number six, you got to reduce side effects. All right? So, what do you need to address all of these steps and these problems? Well, to kickstart your HPTA, you're going to need a combination of Clomid and Novadex. All right? This is going to help to restart your HPTA. Now, I've done my videos on Clomid and Novadex that you should watch so you can see in their entirety. You know, I'll just quickly, clomiphene increases free testosterone levels in men with both secondary hypogonadism and erectile dysfunction. All right? You know, for those with lower than normal, you know, age-matched levels of testosterone, treatment directed at normalizing testosterone with Clomid is a viable alternative to giving androgen supplements. These are all things that have been, come up with through studies, etc. I've talked about Novadex, I've talked about Clomid, how they jumpstart production and why and what they, originally, were meant for. As Clomid is meant to actually help, women that are infertile to become fertile or pregnant. Novadex is a breast cancer treatment, but they have their benefits to jumpstarting natural testosterone production. But make sure you watch those videos to see them, because I don't have the time to sit here and go over them all in detail like I did before. Now, what about preventing catabolism and preventing strength loss? Well, that's where MK2866 is used to help lower cortisol levels and possibly increase IGF levels. It's going to keep your strength up, and in only 4 weeks, it's never shown to be suppressive unless you're using something that's not MK2866. Then it might show to be suppressive, but that obviously isn't the real deal. Preventing fat gains, well, that can deal with cortisol, which is a big problem in post-cycle therapy, and that's where GW501516 comes into play. There's no suppression there, obviously. So I've seen people question that as well, but it's used specifically for what? To increase endurance, all right, to help lower cholesterol, lower blood pressure, to help cortisol levels, which is, cortisol is absolutely horrific when it comes to post-cycle therapy. All right, when you are in post-cycle therapy, you are going to get a major spike in cortisol. And cortisol is something that is termed the gains killer for a reason, because it's going to put you into a catabolic state which will not allow you to build muscle. It's the worst thing known to man in post-cycle therapy. All right. It's going to eat away your muscles, and it's going to have you have some unwanted fat gain on top of all of that. All right, so you're going to lose muscle and gain fat that you just worked your butt off for your entire cycle. So GW and MK are going to help to prevent that rise in cortisol. Not only that, but they're going to keep you performing at a much, much, much higher level. They're enhancers, but they're not like steroids. So they're going to keep your levels up where your levels are normally dragging down in post-cycle therapy, where you're struggling. All right. There's also other needs in post-cycle therapy that need addressed that a lot of times people never talk about. All right. Now, if you guys have followed me, you know at DGA Nutrition that I have Organ ST, which is an all-in-one protectant. All right. And everybody thinks that you just have to jumpstart natural testosterone production in PCT, but that is not the case. There's hormonal fluctuations. Higher liver enzymes are possible. Increased blood pressure, pressure on kidneys, pressure on your endocrine system, high stress, the cortisol we were talking about level. The list goes on and on and on. And something like Organ ST and All-in-One helps to prevent these problems. It addresses them, it corrects them, and it helps you recover in a much more timely manner. So that's something to keep in mind. Now, you also, when I talked about balancing hormonal levels, that's where something like aromasin comes in, all right? To prevent estrogen levels from increasing and IGF from decreasing, that's where aromasin comes into play to help you. So, what are we looking at here? We've got Clomid, we've got Novadex, we've got aromasin, we've got GW501516, MK2866, and an all-in-one protectant. Now, a lot of people go, oh, that's overkill, that's way too much, that's way too much, that's way too much. Okay, then you can simply just run the normal standard, and I hate when people say that because it's not standard. It's not. It was standard in the 80s. Clomid and Novadex. Okay, will that jumpstart your HPTA production? Sure. But what about all the other areas that we were talking about? Why do people struggle, and why do people, they may recover eventually. Actually, you know what? I take that back. Chances are very high that you will recover eventually. But after what time and after what losses? All right, so let's say you do recover in maybe 4 months. Well, by that time, you're going to have lost most of your gains. You're going to have struggled through PCT. You're going to have had several months of feeling like crap. And you're going to have wasted all of that cycle time that you worked so hard for to basically come out with next to nothing. Or you could run the bigger PCT that I just laid out for you. Okay, you run that PCT. You recover in maybe a month. You keep most of your gains. You're feeling great in between cycles. You're not going through that depression phase. The more you delay recovery, the more longer, issues that you're going to have maybe down the road as well. It's too hard on your body. You don't want things like toxicity lingering around and giving you longer problems. Think about it. If you drive in a car and you don't do maintenance when you're supposed to, right? and you let it go and go and go, then you do the maintenance, but there's more wear and tear on the car, right? So if you're doing that to your body, then there's obviously more wear and tear. Even if it does get fixed or recover, the wear and tear is far greater, and it's giving you far more issues down the road where you're not going to last as long, just like a car would give out on you eventually. So I don't know. If it's me, I'm always going to do the best to prevent long-term damage and get me, straight right then and now. It's just up to you how you do things. I always do things in the most complete manner, and I teach things in the most complete manner. So it's really up to you how you proceed. But that is the post-cycle that I have always told people is the best for full recovery and maximizing your gains retained. Nolva, Clomid, GW501516, MK2866, Aromacin, and Oregon ST. You're all in one protectant. So, that being said, www.icearms.com/forums. I'm also on the Elite Fitness Forum and Evolutionary Forum. Dylan at icearms.com is where you can get me with all questions and comments on my email. Please read the descriptions. You don't want to miss out. I talk about what's in the video, also my social media, all the ways to get me there, all my old videos. So you want to see those links. So, that being said, stay tuned for plenty more to come. Dylan Gemelli, signing off.